Hi everyone, and welcome to RAG Hospital podcast. My name is Victoria Shedwag, and I'm more than happy to be your today's host. Today, we are discussing a very crucial topic, understanding stroke. And I am hosting distinguished guests coming from RAG Hospital, Dr. Noushin Mehrbod and Dr. Waseem Daar. We are going to start our first question. What is stroke? Dr. Noushin, would you like to start? Ladies first.
Yes, stroke is the cerebrovascular disease that can cause blockage of blood flow to the brain. Mm-hmm. And in fact, it can cause the damage in the brain cell. Mm-hmm. But TIA, or transient ischemic attack, is the situation that mimics the stroke, but it is not permanent, and it cannot cause the permanent damage. It's less than 24 hours, most of the time between the seconds or the 1 hours, and resolve quickly. This blood clot is coming, but resolve quickly, which is why we don't have any permanent damage to the cell.
Okay, I understood. So, Dr. Waseem, would you like to add something, or we can move ahead with the next question? Huh?
Yeah, we can move ahead.
Yeah, okay. So the second question to Dr. Waseem, what are the most common causes of stroke? In terms of the age and lifestyle, I believe it plays also a huge role.
Yeah, basically we divide strokes in two types. So each has different set of causes. Mm-hmm. It is ischemic stroke or hemorrhagic stroke. Yeah. So in ischemic stroke, there will be a blockade of a blood vessel that supplies blood to the brain. So once there is blockade, the blood flow does not reach the brain, and they will develop symptoms depending upon the territory of the brain that is involved. Mm-hmm. The second type of stroke is a hemorrhagic stroke. In hemorrhagic stroke, there is this blood vessel bursts. So the blood comes out and it causes a mass effect or a pressure effect on the surrounding brain and causes its effects. So ischemic stroke is the most common subtype. Around 80 to 85% people will have ischemic stroke, and 10 to 15 will have hemorrhagic stroke. So the causes are different. In ischemic stroke, one of the most common causes is hypertension. So we know that hypertension is quite common. Almost we will have some members of our household who will have hypertension. And hypertension can cause both hemorrhagic strokes and ischemic strokes. Second important cause is diabetes mellitus. So diabetes mellitus causes thickening of the blood. The blood becomes more viscous, and there is formation of plaque. Mm-hmm. So once this plaque gets off from the blood vessel, it can travel distally to the brain and cause blockade of the blood vessel. So it will cause an ischemic stroke. So another cause that we often found is obesity. So obesity, again, is part of a lifestyle disease that we call nowadays. So in obesity also, the blood becomes thicker. It forms clots, and the clots travel distally to the brain and cause blockade of the blood vessel, resulting in symptoms suggestive of stroke. So another cause would be cigarette smoking. Mm-hmm. As we know, cigarette smoking has a lot of chemicals, and these chemicals again may cause thickening of the blood, formation of plaques, and resulting in strokes. So other causes are like heart disease. So what happens in heart disease, particularly people have we call them rhythm disorders like atrial fibrillation. Mm-hmm. So in atrial fibrillation, there form clots in the heart. So once the heart pumps the blood, so the clots go distally to the brain and cause blockade of the blood vessels. Mm-hmm. So these previously we used to think that these causes are more common in adults or elderly people. So usual age of stroke would have been around 60, 65. But nowadays we have found that these causes can also be found in young people, particularly as we have seen that a lot of people, they have jobs that involve sitting. And sitting, nowadays called sitting, is new smoking. So similar effects that smoking has, sitting has the same side effects.
And that's interesting. I didn't know about that, actually.
Yeah, so sitting, lack of physical activity, particularly nowadays we see in young people because of their office jobs. So it causes this hypercoagulability of blood, thickening of blood, and formation of clots. And those clots then go distally to the brain and cause strokes. Then some people who are young, we also have another category of strokes where their genetics plays a part. So whenever we have a person who has a young stroke, like stroke happening in a person who is less than 40 years of old, we have to rule out genetic cause of the stroke as well. So these are some of the common causes of strokes that we often find in our patients.
So we're going to elaborate on that a little bit later, definitely. Okay. So I heard the acronym FAST. Could you elaborate on that? What does it mean? What does it stand for? In terms of understanding stroke, each letter means something. Yeah, we pronounce it fast, right?
Yes,
Fast.
we
Yes.
pronounce it fast, and it is the abbreviation of some of the words.
Got it.
F is the abbreviations of the facial drop. A for arm weakness, S for speech disorder like slurred speech, okay, and the T for time to reach to the hospital and the neurology department. So because the brain cells are so sensitive to the lack of oxygen, it's very important to reach the patients before 4.5 hours, because in this time we can rescue and we have a good recovery for the patient, which is why we have to alarm the families, the members, and everybody that in there the crucial cases and risk factors to be known about the sign and symptom. Whenever they encounters, just call the emergency and reach to the hospital for a rescue. And we have two methods of treatments for rescue the patients when they arrived. One of them is thrombolysis and the other is mechanical thrombectomy, okay? It depends on the situation, which vessel is affected. We can use one of this method in the golden period when they are coming.
You mentioned 4 or 5 hours, yeah? Is
Yes,
that right?
4.5 hours.
4.5 hours. So then after this period, the percentage is less likely.
Yes, for
to
sure.
help.
Yeah.
Okay, I understand. So as you say, very important is time. So T, I think, as the last one acronym, I think it plays a huge role. So now, could you walk us through with types of strokes, Dr. Waseem? Maybe would you?
So as I had already told that we broadly classify strokes into ischemic strokes and hemorrhagic strokes.
Yes.
So as I told you, ischemic strokes usually occur because of blockade of the blood vessel. Now
Right.
it depends upon the clot, where from the clot has come.
Yes.
So if it comes from the heart, we call it cardioembolic stroke. Or if it comes from an artery, like a blood vessel, we call it artery to artery stroke. Then there is another type of stroke that happens more in people who have hypertension, diabetes, mellitus.
Okay.
So small blood vessels in the brain, they get clotted. So we call them small artery strokes. And if we don't find any cause of the stroke, we call them cryptogenic strokes. So whenever a patient comes to us, so there are two parts like that we have to analyze. First as the treatment, and second is the evaluation, because patients can have recurrent strokes. So we usually classify patients into these categories, then accordingly do many tests so that we can find the cause of the stroke. So this classification helps us into evaluation of the patient. And I told you the hemorrhagic stroke, the other one, where there is bursting of the blood vessel and blood puts pressure on the brain and causes symptoms. It is again divided into some types. One of them is called intraparenchymal hemorrhage, where there is blood inside the brain. And second is called a subarachnoid hemorrhage. Subarachnoid hemorrhage, there is blood, the blood vessel bursts, the blood is outside the brain, inside the sickle, outside the brain. So it puts pressure on the brain and it causes raise in the pressure in the brain and causes symptoms because of that. So this is how we classify, how we categorize this stroke.
So the next question actually related to what you have said. So you mentioned there are different types of blockage, whether it comes from the heart, from artery, so on and so forth. How do you find out where it comes from?
Yeah, for example, if a patient comes to us with an ischemic stroke that I told you happens because of the blockade of the blood vessel, so we have to find the cause. We have to find where from the clot has come.
So how do you find it where it comes from?
So as I told you, the clot can come either from the heart or from another blood vessel.
Yes.
So if we have to check whether it has come from heart, so we'll do an echocardiography.
Okay.
So echocardiography checks, we refer the patient to the cardiologist, he performs an echocardiography and checks whether there is any clot in the heart, so that has gone to the brain.
Okay.
Second thing, another test we do, we call it Holter. So Holter measures the rhythm of the heart. So if any patient has any rhythm disorder, we call them atrial fibrillation. So they will have that as a source of strokes. So this will be for the clots that come from the heart. Now for the clots that come from the other blood vessels, so we call it angiography. So angiography we do for the blood vessels to check if there is any clot. So normally there are three types of angiography. CT angiography, MR angiography, and another we call it DSA.
So for example, if a patient comes to you and he says, well, this is what happening to me, do you assign all of these tests at once, or you try to find which is the most probable cause, and then you assign it the tests?
It depends on the situation of patient.
Yeah.
You know, from the CT and MRI, even with the shape of the stroke, you can understand that it is the format of embolic, or even it is the format of the atherosclerotic from the brain. If it is the wedge shape, most of them are embolic, that's coming from the heart. So you can estimate it, okay, it's coming from the heart, so it's more evaluation from the heart. But most of the time we do evaluation for both, because we cannot make a differentiation between both them, and we cannot separate. Sometimes the patient have both situation all together. Yeah, they have atherosclerosis in the brain vessel and also have cardiac issue. So you cannot separate that it is just only because of this. But if the patients have recurrent stroke and just it's happen in one side of the brain hemisphere, you can imagine and you can predict that, okay, it is from the vessels of the brain because just only one side is affected. But if both the hemisphere is affected, so it's probably coming from the heart because embolic is both sides, so which is why you can predict. But in our clinic, we check everything. We check the CT angio for the brain, we do the ultrasound Doppler, carotid Doppler of the both neck, and we do Holter and echocardiography for the heart. Yeah.
Okay, I understand. Now it's clear to me. Thank you so much. So now, how to move further? Let's say, how can we prevent? Is there any possible way that we can prevent actually having a stroke? Are there any tests to see what might happen in advance? You want, Doctor?
So see, 80% of stroke risk factors. Each patient who has a stroke has a risk factor.
Yes.
Okay. Normally, people who have diabetes, who have hypertension, who have atrial fibrillation, who are smokers, who are obese, who have physical inactivity, so who have high cholesterol. So these are called risk factors for stroke. So if we can control these risk factors, 80% of strokes can be prevented.
80? Oh, that's a very high percentage.
Yeah. So, but the issue is that we are not able to control because lack of motivation from the person as well, who is a patient, and then all the risk factors to control them is not 100% possible. So, for example, if a person is diabetic, he has to control his blood sugar. He should regularly check his cholesterol if it is high and accordingly treat. He should have a physical active program for at least 30 minutes per day for 5 days a week. If he is smoking, it is double. It is if you are diabetic plus smoking, so you are at a very high risk of having heart attack as well as stroke.
That's a double trouble. Yeah.
Yeah. So you should never smoke, and diabetics have a high risk, so they should particularly be asked to never smoke. Then you should regularly take a good healthy diet, educate sleep, and good sleep, at least 7 to 8 hours in adults, is very important. So if we can manage these risk factors, plus if somebody has like atrial fibrillation, heart disease, so they have to take specific medicines for that. So if we can control these risk factors, 80% of risk of stroke can be prevented. So then people have genetic factors as well. We cannot prevent them. So if you have a genetic risk, but at least the other 80% we can prevent, and we should work on that.
You mentioned that early age of having a stroke. What would be the age bracket?
It is before than 50. If it is before than 50, we call it early, or we call it a stroke in young adult. But even we can see the stroke in the children. We cannot see that we didn't see a stroke in children, but it's a very rare case if the children have a story of cardiac issue or some blood disorder like sickle cell anemia. They may have a stroke. So be careful about the children examination, not just thinking about the simple things like as a migraine headache or small dizziness. Sometimes they are the sign of the stroke. So we have to mention this one also in our mind, that it can be the sign of the stroke even in the children. But most probably in the children that have some underground disease, like as a cardiac issue, maybe the first time it was diagnosed by the stroke. Then after investigation, we see that, okay, these children have some valvular heart disease or PFO or something else.
You mentioned before FAST, acronym FAST, facial drop-in. Would you see the same with children?
Yeah, we can see.
How
We can
does
see.
it-
But
how
most,
does
you
it
know,
work?
in the children, not the same as adult. Most maybe
Yeah.
with coming with severe headache or maybe dizziness or something like. Yeah.
But the facial dropping, how would it look? That the cheeks are falling
See, this
down?
you can see this will go to one side.
Uh-huh.
So normally, what happens if these muscles of our face, like lips,
Yeah.
if this face is weak,
Okay.
the normal side will pull it towards its own.
Just asymmetry. You can
You will
see
be
the
asymmetry.
asymmetry
Yes.
when they are speaking.
Yeah,
you
then
can
you
see
can
the
see this
asymmetry.
fold in here, this depression. This it will be lost.
I said I had exactly same example in my family. Yeah, yes. The one side of the body was a little
Yeah.
bit numb.
Okay, so
Yeah, so that was definitely the stroke. Question from lady to lady. What are the latest advancements in stroke treatment? Could you tell us?
Yes, there are now two methods of treatments for the patient if they are coming on the golden time, as I mentioned.
Yes.
The first one is thrombolysis, that now a new generation of medication, Tensaplast, is coming. Before we use another brand. Now this brand have a new invention in the treatment that can release the blood clot without side effect, quickly effect, even usage is easily and quickly. And the mechanical thrombectomy, that if the clot inside the large vessels and before 24 hours the patient's coming inside the hospital, we can remove it by the thrombectomy, by the helping of the surgeons without any side effects and full recovery.
Wow.
That is the perfect, this is the perfect outcome that's now. Yeah, and we achieve it. The same as ischemic heart attack. Now we can move in the stroke as this outcome. Yeah.
Beautiful news. How long does it take usually the treatment?
For the thrombolysis, just maybe 1 hour we use them, and then reevaluate it for 24 hours after that to see that no any side effects and bleedings. And the recovery, you can see definitely in the clinic that recovery is that patients completely, all the signs disappear. And for thrombectomy, okay, they have to go for the surgeries before 24 hours, and after that you will see that all the signs recover back after.
So after 24 hours, the patient is back home, and then how long do you do monitoring, if I may say?
Monitoring after discharge from the hospital. Okay, first week after discharge, you can monitor it. Then first month, then every 3 months, you can ask the patient just for the follow-ups and prevent the risk factor and something like this.
Yeah, follow up. Okay. Beautiful news, actually. That will give so much light and positive light into the future. So maybe now I will direct the question to gentlemen with us.
Yeah.
So the next question. So what are the warning signs or symptoms that people often ignore before having a stroke? I would say red light, yeah, that we should be aware of.
See, as I told you, stroke happens in people who have risk factors.
Yes.
So all people who have risk factors like diabetic, hypertension, then if they are smokers, they have physical inactivity and other risk factors of stroke. So they should keep certain things in mind, that if these things had happened in us, we should immediately seek a consultation with the doctor. Just like symptoms of fast. If somebody has developed sudden onset facial weakness, even if it goes away, you have to directly go to the doctor, get it evaluated. Similarly, some person has a sudden onset. The one thing I want to put some on this impact on the word is sudden. Stroke means sudden.
Yes.
Some person has like blindness for 1 year. It is not stroke usually. Stroke means sudden. So sudden, if you develop any neurological symptom sudden, it could be stroke. Okay. So if some person has blindness, sudden onset blindness in one eye, it could be a stroke. You have to seek a consultation. Sudden onset hearing loss could be a stroke. So if you have sudden onset hearing loss, go to a doctor. Similarly, sudden onset weakness, sudden onset numbness. If you feel these symptoms, even if they are transient, they remain for a few seconds only, you have to seek a consultation. And second, as I told you, the people who are at risk, they should regularly check their cholesterol, regularly check their blood pressure, regularly check their sugar, regularly. Sometimes we may also do some carotid Dopplers to check if there is any plaque in this blood vessel. So all these things they can do to prevent strokes. But main important thing is that control of sugar, control of blood pressure, regular physical exercise, avoiding sedentary lifestyle, avoiding smoking, and have a good diet and good sleep. Those things can help a long way in preventing strokes.
Okay, so how about those people who already have family history? What can we advise?
First of all, we have to see that it is stroke in young adult in the family history, mean less than 50 or over than 50, okay? Because if it is over than 50, most of the time, age, hypertension, and diabetic and hypercholesterolemia are the major risk factors. But less than, we have to thinking about some genetic disorders, like we have seen some deficiency of maybe protein C, protein S, homocysteine, some like this deficiency. We have to check this one. But if it is over that, okay, we do most of the time routine tests for the cholesterol, checking the blood pressures, for the diabetes, mobilities, or any smoke cigarettes or alcohol use or something like this. It depends, and it depends that how many person in the family have these risk factors, have this stroke. For example, if somebody comes that say, both my mothers and fathers, and even my older brothers have the history of the stroke, so he will be most at the risk, and we have to start to evaluate for the ALS and check the genetic factor also for them.
We already actually spoke about the children and young adults, that there is still a chance to have a stroke. Or maybe we can elaborate a little bit more on that. It seems a little bit surprising. How come a young adult or children even can have a stroke? We usually associate it with, of course, older people. Can you tell us the percentage even?
So overall, young strokes are very uncommon. They're not that common as compared to adult strokes.
Yes.
But if we have two categories of people, one percentage of people who present with a stroke, even if they are adults, and we do all kind of those tests to check the clot has come from heart, it has come from the vessel. If we don't find any cause, then we have to dig deeper. So we have to see if there are any genetic causes of stroke. And we do a lot of testing for that, and if we find any cause, accordingly we can treat. Same, these subset of these causes, they can cause strokes in young. So somebody has a genetic condition that predisposes the person to have a thick blood. So it can cause clots not only in the brain, it causes clots in the legs, clots in the heart, clots in the lungs. So it can cause clots in the brain as well. So one of the common conditions, particularly seen in women, is we call it APLA syndrome, antiphospholipid syndrome.
What is it?
Antiphospholipid syndrome.
Okay.
So it predisposes to clotting. So people will have strokes, people will have clots in legs, brain, heart, or lungs, okay? And second, it predisposes to abortions in women. So if we feel any woman who has recurrent abortions, and she has a stroke, so most likely APLA is the cause. So such kind of people need evaluation, and accordingly they need lifelong treatment. They are usually young. Similarly, children, if they have history of trauma, or if what happens if there is severe trauma, the blood vessel gets disrupted, the clot is formed, it can go to the brain and cause strokes. So it is another cause of strokes in young. And other genetic causes, as Dr. Noushin told, protein C deficiency, S deficiency, other factor V Leiden. These are many types of causes that can cause strokes in the young. So accordingly, if we find a patient who is young, we dig deeper and try to find out whether these are responsible for the strokes. And such patients usually need lifelong treatment of that to prevent recurrent strokes.
Another things I want to add to Dr. Waseem, that if you are a woman more than 35 years old and have the history of migraine headache, and being under the contraceptive pills, the risk of the stroke increasing on them. So you have to mention to them about the prevention method if they have the history of the migraines already and using some OCP pills.
So the last question, just to wrap it up today, how can we spread awareness? Of course, we are doing this podcast, particularly want to spread some awareness in order to help people to prevent it. Can you tell us some other ways how we can share education, awareness in terms of the stroke prevention?
Especially, we have to aware about the risk factors. Okay.
Definitely.
Then the healthy lifestyles to know. I mentioned to all my patients at least 30 minutes per day walking. Try to walk. Okay, and try to use low salt, low sugar, low fat meals. Okay, and smoke cigarette if you can. Even decrease the amount and even alcohols, and. Try to control your risk factor. Check your blood pressure, check your blood sugars and your cholesterol levels. If need medication, okay, start the medication. And in the media, it's better to inform all these risk factors and even at school for the students to know about. And if they see anybody around themselves that these manifestations coming, so quickly and suddenly they can call the emergency to save one patient's life.
So around after the age of 25, 1 in every 4 adults will have a stroke.
Oh,
So if we
that's
are
a lot.
8 people here or 4 people here, one of us will have a stroke in our life. So stroke affects maybe us, or if our family member is involved, maybe him or her. So remembering the signs of stroke, how stroke presents, and what are the treatment options. As Dr. Noushin told you, that treatment of stroke is time dependent. If we reach hospital late, there is no fun. Like we have to give treatment, but the treatment that is more important in stroke is missed. So time is important. So from your side also, as from media and from other celebrities and other guys, so they have to promote stroke campaign.
Yes,
okay,
we spread awareness now.
spread awareness. Yeah,
Yes.
and some nowadays people do those walkathons, other things also for heart, for stroke, for other things. So all these things can be done to like spread awareness about stroke. What are the risk factors, and once it presents, how to report to the hospital, and how quickly to report actually. So all of these things can be done to like help spread awareness about stroke.
Thank you so much one more time. That was so insightful. Thank you so much for being here and spreading this awareness. Thank you to our beautiful viewers and listeners. That was RAG Hospital Podcast. My name is Victoria Shvedouak, and stay tuned for the next episodes.